Thank you for your introduction, Mr. Smith, ladies and gentlemen, dear colleagues. I am very nice to meet you and to have the opportunity to report to you some results of my investigations. The theme of my presentation is a conifer green needle complex. Its use mainly in oncology and some other medical applications. Its content of my presentation, contemporary issues about cancer prevention, the chemical content and properties of a conifer green needle complex, the results of preclinical study of conifer green needle complex, the results of my clinical studies of conifer green needle complex, and briefly from other medical applications of this natural product. Firstly, I would like to give you some general comments regarding cancer prevention. According to the World Health Organization's estimation, in the 21st century in the world, annually 10 or 12 million of people were diagnosed with cancer, and 7 or 8 million of them died because of cancer. A comparison of standardized rates of cancer incidence for the last 30 years was shown that cancer incidence has increased approximately by 10 or 20% in the world. And World Health Organization predicts that in 2020 year, cancer incidence will be increased approximately in 2 times. Cancer statistic in Australia. Standardized rates of cancer incidence in Australia are very high in men as well as in women. In men, cancer of the prostate takes the first place in overall cancer incidence. A cancer of the lung, colon, skin and bladder have the highest incidence in this country. And in women, the breast cancer takes the first place in overall cancer incidence, and cancer of the colon, skin, lung and rectum are most common. And for the 15 years between 1980 and 1995, cancer incidence increased by approximately 14% for both men and women. However, in some economically developed countries, in the recent years, the rates of cancer incidence and morbidity has shown the tendency to decrease. For example, in the USA, cancer incidence has decreased since 1992, and cancer morbidity has also decreased from this year. In the European Union, cancer morbidity has decreased in men as well as in women over the last 15 years. And the special analysis was shown that the main driver of decreased incidence and morbidity in economically developed countries is cancer prevention. Therefore, cancer prevention is extremely necessary for the decrease of cancer incidence and morbidity in the world overall and for each country. On the contemporary issues, according to International Agency for Research on Cancer, the main cases of cancer are nutrition disorders and smoking. 30% of cases of cancer caused by nutrition disorders, and another 30% of cancer incidence are caused by smoking. On 5% of cancer cases, are caused by such factors, harmful factors as industrial professional carcinogens, viral infections, congenital mutations, and other. And on 3 or less % of cancer are caused by such factors as reproductive disorders, alcohol, ultraviolet, sun ultraviolet, and many, many others. In human, carcinogenesis is long process which consists of three main stages. The first is initiation. Initiation is very brief study, and during initiation there is a DNA damage by chemical, physical, or viral carcinogens. During promotion, precancerous conditions develop, and during progression, development of microscopic foci of malignant cells to clinically manifested tumors developed. In the most cases, tumor promotion and progression occurs over a long time period because we have very much time for cancer prevention. For example, for the breast, cancer promotion and development of precancerous lesions such as atypical hyperplasia and carcinoma in situ take about 14 or 18 years. And the cancer progression from nascent focus of malignant cells to clinically manifested tumors maybe take 6 or 10 years. For the prostate, cancer promotion and development of such precancerous lesion as prostatic intraepithelial hyperplasia may take 10 years, and cancer progression to clinically manifested tumors may take 3 or 15 years. For the colon, adenoma of the colon, that is a precancerous condition for this organ. Its development may take 5 or 20 years, and progression of microscopic focus of malignant cells to clinically manifested tumor may take 5 or 15 years. It is true for the most all other malignant tumors in human. Therefore, on the modern science, cancer is a genetic disease of cell caused by many carcinogenic factors of different nature, and theoretically 80% of cancer causes can be eliminated. And there are 3 main modes of cancer prevention. The first is primary cancer prevention. Primary cancer prevention is preventive measures in healthy people and people with factors that increase cancer risk. Secondary cancer prevention is evaluation and treatment of precancerous diseases and diagnostic of a cancer in the early stages and effective treatment of cancer at early stages. And tertiary cancer prevention is prevention of recurrence and metastasis, and also of secondary primary cancer in oncological patients that have undergone anti-cancer treatment. Now it is estimated that there are 4 main, the most effective directions of cancer prevention. The first is health, nutrition, and dietary cancer prevention. The second is struggle against smoking. The third is screening for evaluation of precancerous lesions screening programs and early forms of cancer, plus treatment of these diseases. And the fourth is cancer chemoprevention. What is it, cancer chemoprevention? By definition of International Agency for Research on Cancer, cancer chemoprevention is the use of pharmacologic or natural compounds that inhibit the development of invasive cancer by different mechanisms. Now it is estimated that cancer chemoprevention is very promising direction in overall field of cancer prevention. For example, in many epidemiological studies, it has been shown that some anticarcinogenic compounds which were used as synthetic or natural dietary supplements, not in contents of the food, but separately as dietary supplements, during 10 or more years can decrease cancer risk. For example, multivitamins decrease risk of colon and breast cancer, vitamin A decreased risk of colon cancer, vitamin E decreased risk of cancer of the colon, breast and other organs, vitamin C also decreased risk of cancer of the stomach, colon, breast, prostate, ovary, myeloma and some other tumors. Folic acid or calcium decreased risk of colon cancer, zinc decreased risk of prostate cancer. In several large randomized placebo-controlled intervention clinical trials, it has been shown that some cancer chemopreventive drugs, mainly pharmacological drugs, which were used during from 5 till 12 years, decreased cancer risk. For example, anticarcinogenic drug tamoxifen decreased risk of breast cancer in women with high risk of breast cancer. Alpha tocopherol decreased risk of prostate cancer in smoking men in Finland. Beta-carotene plus alpha-tocopherol plus selenium decreased risk of stomach cancer and overall tumor incidence in people of China, which were lived in regions with high risk of stomach cancer. Selenamethionine decreased risk of the prostate cancer, of the liver cancer, and overall tumor incidence in the patients with some pathologies such as skin mesothelioma and viral hepatitis B. Now it is suggested that anticarcinogenic drugs for cancer chemoprevention, pharmaceutical drugs, should be correspond to the 5 main requirements. It is very serious requirements. The first is clinical efficacy. Clinical efficacy is ability to prevent development of a cancer of one localization or better several localizations. The second is absence of toxic and harmful side effects or minimal toxicity of the chemopreventive drug. The third is drug must be well tolerated by patients over the long time because cancer chemoprevention is very prolonged treatment. And the fourth is it is desirable additional health benefits together with anticarcinogenic action. And the fifth is the finished pharmaceutical forms should be developed for oral or in some cases for topical application. And now, cancer chemopreventive drugs applied today in a clinical practice do not meet all above mentioned, all these mentioned requirements. On my opinion, natural medicines are ideal drugs for cancer chemoprevention. For example, natural medicines are a complex of anti-carcinogenic substances. They are, as a rule, are not toxic or have low toxicity. Natural medicines can be used for a long time. Natural medicine, as a rule, have various health benefits in addition to anti-carcinogenic action. And natural medicine are used also, as a rule, in oral or topical forms. It's another section of my presentation, conifer green needle complex, or abbreviated CGNC. CGNC is a natural biologically active extract obtained from green conifer needles of pine and spruce. On its physical property, CGNC is a dark green paste with a strong smell of conifer needles. And there are several forms of CGNC, tablets, capsules, and toothpaste, as in Russia as well as in Australia. Its chemical composition of CGNC, it is the main components of this natural medicine. It is content of these components in CGNC, and it is recommended daily intake for human. The major active ingredients of conifer green needle complex are chlorophyll, carotenoids, vitamin E, vitamin K, phytosterols, polyphenols, squalene, resin acids, and essential oils. Therefore, CGNC contains a range of important concentrative, nutritive and biologically active compounds, providing consumers with levels close to the recommended daily intake from ingestions of a relatively small amount of this natural medicine. Now I would like briefly to give characteristics of the main ingredients of CGNC. The first is chlorophyll. Chlorophylls are porphyrin compounds that are plant green pigments, and CGNC contains mainly chlorophyllene. Chlorophyll derivatives have various anti-carcinogenic effects or anti-carcinogenic mechanisms that are listed in this slide. In experiments, chlorophyll inhibited carcinogenesis of the colon, liver, skin, mammary gland, and other organs induced by carcinogens in animals. In a clinical study, for example, chlorophyll decreased risk of liver cancer. Chlorophyll has also other favorable effects listed here. The main other effects of chlorophyll are the wide spectrum of antimicrobial activity, immunostimulating activity, and antioxidant activity. These are carotenoids. CGNC contains mainly carotenes and xanthophylls. In overall, carotenoids are tetraterpene compounds that are plant pigment of different colors. Carotenoids have various anti-carcinogenic mechanisms that are listed here. In many epidemiological studies, a high consumption of beta-carotene or several other carotenoids decreased risk of many tumors such as lung, hand and neck, esophagus, stomach, colon, liver, cervix, breast, prostate, endometrium, and other. Some epidemiological and clinical studies, high consumption of beta-carotene also decreased risk and cause progression of various precancerous conditions, such as atrophic gastritis and intestinal metaplasia of the stomach, adenomata of the colon, chronic esophagitis, oral leukoplakia, dysplasia of the cervix, and others. Many experiments, beta-carotene and several other carotenoids inhibited experimental carcinogenesis in animal. Carotenoids also have other favorable effects. The main other effects of carotenoids are antioxidant activity, immunostimulating activity, and they also have ability to normalize lipid metabolism and to decrease risk of cardiovascular disease. Vitamin E, CGNC contains natural vitamin E. And natural vitamin E includes 8 forms of tocopherols and tocotrienols. Vitamin E also have various anticarcinogenic effects listed here. And for example, it is very interesting that this vitamin regulates the hormonal balance. In particular, it acts as anti-androgens in arresting clone expansion of microscopic foci for tumors of the prostate. In many epidemiological studies, high consumption of vitamin E decreased risk of cancer of the lung, esophagus, stomach, colon, breast, prostate, skin, and some other tumors. And for the other effects, favorable effects of vitamin E, the main are that vitamin E has antioxidant activity, anti-atherogenic activity, and immunostimulating activity. Vitamin K. Vitamin K includes a series of compounds of the naphthalene group. Vitamin K has anti-cancer effects, not anti-carcinogenic, not chemopreventive, but direct anti-cancer, anti-tumor effects listed here. In some experiments, vitamin K has been shown to suppress growth of human tumors such as hepatocellular carcinoma, leukemia, nasopharyngeal carcinoma, and breast carcinoma. There are very interesting compounds, phytosterols. Phytosterols or plant sterols are steroid compounds of the plant structurally related to cholesterol. And CGNC contains mainly beta-cytosterol. Phytosterols have some anticarcinogenic effects listed here. For example, in epidemiological studies, high consumption of phytosterols decreased risk of a cancer of the colon, prostate, and breast. And experiments, phytosterols also inhibited carcinogenesis in animals. From the other favorable effects, the main are that phytosterols have anti-atherogenic activity. Squalene. Squalene is an isoprenoid from the group of polyphenol compounds. Squalene have also anticarcinogenic effects as well as various other favorable effects. From other effects, it's very interesting that squalene protects skin cells from peroxidations, participates in detoxification of harmful xenobiotics, and have antimicrobial activity, in particular against tuberculosis. Polyphenols are long-chain alcohols, and it is very interesting that conifer needles are one of the richest and most widely available sources for extraction of polyphenols. Polyphenols stimulate the immune response, cellular